Is there a way that, is it something that maybe they could just like learn or instinctively do to fall safely? Is there any like practice they could do? I don't know, tuck and roll or something?
Tuck and roll, yeah. That's the best course of action that I always recommend, especially if we have somebody who is thinking that they're a fall risk, or maybe a family member thinks that they're a fall risk, or a friend or anything like that, is usually always go and consult with their physician. Express to them, I'm feeling a little wobbly, I feel perhaps a little blurry vision, or different things like that, dizzy. I mean, how many times do we say we stood up too quickly and now we feel a little bit dizzy, presence of orthostatic hypotension, different things like that. Right. A lot of these discussions should start with the physician. Ultimately, then the physician's going to be able to say, where do we go from here to further obviously mitigate this risk, form an intervention plan, and obviously make sure that they're as safe as possible.